Hi, I'm Dr. Rahman, and welcome once again to Black Women's Health Podcast. And it's gone through a number of changes, and I am happy to say that it is much, much more than just a podcast. It's a platform. It's a platform for Black women when we discuss health-related issues, in a way that we can understand, that we can relate, that we can do something about it. On this platform, it's actually three in one. We have a segment devoted to pregnancy. It's called 40 Weeks. The first episode had to do with if a pregnancy is 9 months, why do we talk about 40 weeks or 10 months? Explaining that in a way that makes sense, explaining something that may have never been explained before. And that's what the goal is, taking really basic concepts, breaking it down, because it's possible that no one has ever taken the time to explain these things. So the OB segment is called 40 Weeks. The GYN segment is called Today's Woman. And again, same concept. We are taking basic concerns that women may experience, and we are highlighting how it might affect Black women, because this is a platform for us, by us, truly FUBU. And then the last segment are the interviews, because we just need to shine the light on the many Black women out there that are achieving, that are striving, that are making contributions that we may or may not be aware of. And so it's always with great pleasure that I have the opportunity to discuss and interview these women. So that's the platform. OB obstetrics, because we need to do better in terms of maternal mortality. GYN, to help women have a better understanding of their body and the changes, giving you information that's not biased in any way, but trying to provide the facts as we know it in a way that's understandable. As always, I welcome your comments. This is in many ways uncharted territory, but it's something that has to happen. And so on today, this is week 2 of 40 weeks. And last week we discussed, why do we say 40 weeks if a pregnancy is 9 months and there are 4 weeks in a month, that's 36 months. Why do we talk 40 weeks? Hopefully you understand that. If not, please check out the previous episode. This week we're talking about prenatal visits. How many are necessary? Why do we say that? For the past almost 100 years, it has been that a pregnant woman was expected to go to her obstetrician every 4 weeks, up into 28 weeks. And then from 28 weeks to 36 weeks, she was to see her OB every 2 weeks. And then from 36 weeks up to delivery, every week. And so if a woman started seeing her OB in her first trimester, she would have somewhere around 12 to 14 prenatal visits. And that's kind of been accepted in this country as standard obstetrical care. Where does it come from? And why? What is it based on? We're not so sure. we're not so sure. It just became accepted practice. An interesting thing happened in related to COVID. Once COVID became prevalent, became a pandemic, and people had to sequester, the question of how many prenatal visits does a woman need? That question was raised because in reality, it wasn't possible to do those 12 to 14 weeks of 12 to 14 prenatal visits as had been accepted as the norm. And so it raised a discussion about, is it really necessary for an OB patient to be seen that often and that frequently? And the other question became, can we use other methods such as telemedicine, virtual visits that would take away from the number of in-office visits that might be required? And the overwhelming thought was, rather than it just being a standard, every woman goes to her OB this many times because that's our standard. The thought was, maybe we should tailor the number of obstetrical visits to that woman's obstetrical history and how she's doing in her pregnancy, meaning that we're not all the same. Some women have no significant medical history, have had pregnancies in the past without complications. Does she need the same number of OB visits as a woman that's high risk? And the question is, well, how do you define high risk? And there's some parameters that we have agreed upon, which makes a woman high risk. For instance, if she is 19 years of age or younger, 35 years or older. So younger, older women might very well qualify as being high risk. If she has some sort of pre-existing medical condition, whether we're talking about high blood pressure, diabetes, bleeding disorder, you name it. If there's some, even obesity, if there is some pre-existing medical condition, that might also make her high risk. If she's had a prior obstetrical problem in the past, with a past pregnancy, stillborn, hemorrhage, recurrent miscarriages, that might also make her high risk. And the fourth category, I want to include if it's her first time pregnancy, because this is a time when your body is going through amazing changes that you've never experienced before. And because of that, there may be a lot of questions that you may have, a lot of anxiety about the changes that you're experiencing. So first-time pregnancy. And then the fifth category that I'm including is if you are African American, given that we have such a high maternal mortality rate and a high infant mortality rate. So I am listing 5 parameters that I would consider would make someone high risk: age dependent, less than 19 or younger, 35 years or older, age, pre-existing medical condition, past obstetrical complication, first-time pregnancy, and African American. That would make you high risk, and that would make you someone that might need more frequent prenatal visits, whether the visits are in person, in office, or virtual, and that will be discussed on our next topic. What happens or what should happen during a prenatal visit so that you know when you're getting the type of care you deserve. This is Dr. Rahman, and this is 40 Weeks, and I look forward to talking with you again next week.